If you have floaters, what does it mean? Well, floaters are opacities within the vitreous gel, which forms the central part of the body of the eye, and they start to occur probably from the 20s onwards. That as we get older, the vitreous gel changes and it develops small opacities which appear as black dots in the visual field. And the odd floater is very common. It's of no clinical significance, so it's not a danger to the patient. The real concern is if someone develops a sudden onset of lots of flashes of light, lots of things floating around, and that can be associated with the vitreous gel detaching from its adhesions or attachment to the retina, and that can be associated in turn with tearing of the retina or tearing of blood vessels, which then can lead on to a retinal detachment. So a sudden onset of lots of flashes of lots of things floating around does need action, and you should really be investigated within a couple of days of them occurring to make sure that you're not developing a retinal detachment and therefore requiring treatment. There are other sorts of floaters which sometimes people see as what I would say tadpoles darting about. And these typically occur when you look at, for example, a grey background or you look at an overcast sky. These are entoptic phenomena which relate to the normal physiology of the eye. So I always feel that if you can see these, then that's good because you know that you're alive and the retinal circulation is working. We don't fully understand why they occur, but it may be due to blood cells flowing through the small blood vessels at the back of the eye. So they're very distinct from the black blobs which people see as normal floaters, and they don't require any investigation and obviously not treatment.